Hi everyone, I'm Neil Patel. I'm the head of new ventures at Redesign Health. I became involved in this pitch competition just by an outreach from someone that was helping put it together. And I'm obviously respect the AHA quite a bit and was happy to help however I could. Yeah, it's a very good question. And it's something I think anytime we're building out a business and we're thinking about patient engagement, the predominant motion that people think through is let's have a mobile app. We'll kind of have engagement through there. And I think that we've come a long way in terms of kind of broadband access and mobile adoption. But one of the things that you definitely need to think through is like, what's the channel of communication that the patient wants to engage in? Is it phone calls? Is it text? Is it email? Is it video visits? Is it in person? And really thinking about that and not thinking that there's one size fits all and that a mobile app is going to solve it for everyone, or that you can only build it for iPhone or Android. So I do think that we're much further along in this space than we were probably 10 years ago when we thought about this, and we certainly have policies that have increased access around to rural communities and pretty much around the board. But it's definitely something that we need to be kind of thinking about in the forefront of our minds as we build out these things versus an afterthought as to why aren't we getting engagement in certain areas and solving it on the back end. I would say take a heavy research-based approach to understanding your users. We have within our company and team, we have the benefit of having just strong quant research that does large panel patient surveys, in-depth interviews. But you can do that on your own as an innovator too. It's just take the time and energy to do it, and don't just base what you're building on your own experience, but really use that and supplement it with what does the data say? Do in-depth user interviews with the people that you want to engage with, the patients, their families, whoever you think is going to be interacting with your solution, and make sure you really understand their wants and needs, and then build the solution as opposed to building it and then trying to figure out why it's not working.
Thank you so much.
Yeah, my pleasure.